My name is Vinny Mellnick. I am an associate professor and chief of abdominal imaging at Washington University in St. Louis, the Mellnick Institute of Radiology. So the question is, with regard to determining the size and location of a rectal tumor, which would be more ideal to use, MRI or colonoscopy? This is a great question because the location of a rectal tumor is obviously critical to determining what type of surgery or therapy a patient may need in the context of colorectal cancer. Most crucially, the relationship of the tumor to the anal sphincters and the surrounding structures is essential to their staging and the selection of treatment. Most patients will have rectal tumors initially detected by proctoscopy and or colonoscopy, which offers a direct view of the inside or mucosal side of the tumor. And often that is what's measured with respect to colonoscopy. So the location of the tumor itself or its height is generally defined as the distance from the anorectal junction to the lower margin of the tumor. And traditionally, that is the measurement used to determine the location of a colorectal cancer. In recent years, though, MRI has really become the study of choice to not only locally stage a rectal tumor, but also to determine its height or distance from the anal verge. The reason why is that this is MRI evaluates the full extent of the tumor, not only the inside of it in the lumen of the rectum, but with full view of the surrounding structures. And therefore, by having a wider view of the tumor, radiologists are able to determine whether it's located in the lower, middle, or high rectum, and indicating to the surgeon which approach would be most beneficial. This distance from the anal verge to the lower margin of the tumor on MRI has been shown to be more reproducible with MRI than proctoscopy and with less variability. I would say that in 2021, this is probably more often used as the measurement from the anal verge or the anorectal junction. In addition, since the intent of determining the height of the tumor is to determine its relationship with the surrounding structures, MRI has the advantage here as well. In a similar vein, direct visualization of the rectal tumor with colonoscopy really offers great evaluation of the mucosal side of the tumor. That's because when MRI is performed, the lumen may be collapsed, and that makes evaluation of the inside more difficult. Some rectal masses may be largely exophytic, though, from the bowel wall and extending beyond what can be seen by colonoscopy or by endorectal ultrasound. Conversely, when these masses are partially resected or biopsied during proctoscopy, their size may be slightly different than when they are initially imaged with colonoscopy by the time the patient undergoes MRI. So in a way, MRI and proctoscopy are a little bit complementary when it comes to the size of a tumor, with colonoscopy being better at evaluating the size of the intraluminal component, but MRI being better at evaluating the extraluminal component and how it involves the surrounding tissues.